Bodies pile up in makeshift crematoriums on the streets of Delhi, where COVID-19 now kills someone every 5 minutes. Across India, another 2,600 dead in a 24-hour period. New infections are topping 300,000 each day, more than any other country by far. But experts caution even those numbers, however horrific, are an undercount.
Obviously, India is going through a very terrible situation right now. We're assuming clearly that they need vaccines.
The United States has been under increasing pressure to lift restrictions on exports of raw materials that vaccine makers in India say they need to make life-saving doses. We are working closely with our partners in the Indian government, and we will rapidly deploy additional support to the people of India, the U.S. Secretary of State tweeted. But comments from the State Department last week struck a different tone.
We have a special responsibility to the American people. It's, of course, not only in our interest to see Americans vaccinated, it's in the interest of the rest of the world.
By stockpiling vaccines and blocking the export of crucial raw materials needed for vaccine production, the United States is undermining the strategic Indo-U.S. partnership, tweeted a politician from Mumbai. Stories from the hardest-hit cities tell of the sick gasping for air and left to die while waiting in line for a vacant ICU bed or oxygen to breathe. In some hotspots, train cars are being converted into field hospital units. In his monthly radio address, the Indian Prime Minister urged people to get vaccinated, saying the second wave storm has shaken the nation. But many point the finger at his government for assuming the virus had been beaten and doing nothing to discourage people from returning to old habits. All the while, hospitals and crematoriums buckle under the weight of a pandemic out of control. The Indian government has ordered Facebook, Instagram, and Twitter to take down dozens of social media posts critical of its handling of the COVID crisis, arguing those targeted posts are misleading. Meanwhile, President Joe Biden making clear in a tweet that the U.S. is determined to help India in its time of need. Now, American officials said in a statement that materials needed to produce the AstraZeneca vaccine in India have been identified and will immediately be made available for India. No word from the White House, however, if it plans to send India and other countries in need millions of AstraZeneca doses it has in storage, currently unapproved for use in the U.S. Caryn Ceolin, CityNews.